Dr. Jaffe, what do you recommend for a female who has elevated testosterone levels to the point of 800, measuring 800 in her testosterone numbers?
Well, you have to ask the question of why would a woman have an elevated testosterone? And there are many reasons that could be physiologic. For example, when Patty Doister, my friend and colleague, was running marathons on a regular basis, and she won the Marine Corps Women's Marathon 2 out of 3 years, if I remember correctly, her testosterone was through the roof because of her training schedule. So does this person work out? And I mean intensively. If you walk for 45 minutes a day, you will have a small increase in your testosterone, but it won't go through the roof. The next question is, what liberates testosterone? What stimulates testosterone? And now we're very quickly in the brain. We're looking at the pituitary, and I would measure all of the pituitary factors, anterior and posterior. So that includes the ones we're most familiar with, TSH and ACTH, but also oxytocin, FSH, LH. Look at the precursors to the hormones that produce testosterone. Now you have to fractionate the testosterone. How much of it is free? How much of it is bound? Maybe this woman has a high testosterone binding protein, and her free testosterone is actually what she needs to get her get up and go, because both men and women need testosterone. And generally you measure the total, but in this case you need to fractionate and know the difference between free and bound, because only the free testosterone is actually active. And along with fractionating the testosterone, you need to investigate, is it testosterone, methyl testosterone, ethyl testosterone? There are many metabolites of testosterone that are measured in the total testosterone that have very different biological activity. So now you have to be both a laboratory endocrinologist and a clinical endocrinologist, but fortunately, I had that kind of cross-training. In addition, and this is the worst case, but this is what people worry about, there could be a tumor producing the testosterone. Very unlikely. Needs to be ruled out, can be ruled out by doing what I'm saying along with an MRI. And what do? You do an MRI of the brain, focusing on the pituitary. And frankly, you do an MRI of her endocrine system. An MRI of her adrenals, an MRI of her ovaries, an MRI of her pancreas, an MRI of her thyroid, because this might not be the only thing that's out of range. And may I ask how this came to attention? Why did the testosterone get measured in a, quote, otherwise healthy person? Do you know?
I don't. It's a new patient of one of our customers.
Be very careful to qualify anything you hear from me or Jayashri or any of us as information. Dr. Jaffe suggests that the following might be true. Never say is, never say answer is, except in general. We cannot practice medicine. You're not asking me to practice medicine on the fly, on the corner, on the phone. People ask me all the time to do that, and I explain it's unfair. Unfair to me and unfair to them. So the answer is this needs to get investigated. The thing that I think is of concern is the assumption is that there must be something wrong in order for the testosterone to be so high. And as you've heard from my answer, the answer starts with the more interesting, complicated question of free and bound testosterone fractionated, plus what are the metabolites that are present? Because maybe this is the equivalent of a pregnenolone-Steele syndrome, which is a stress-induced learned process that can be unlearned with certain active meditation, relaxation responses, green dichromatic light, salt and soda baths, restorative sleep, things like that. But I don't want to just reduce the question to a, quote, simplistic answer when I know it's a complicated question. And I'm not even sure that the client, the colleague, knows how complicated the question is. Fortunately, I have studied with some of the world's best testosterone experts. And they now agree with me. You find the cause of why the testosterone is elevated. You don't treat the symptom of elevated testosterone. And when people need testosterone, the other side, when men and women need a boost of testosterone, you give the precursor. You never give the testosterone itself. Because the reason that I'm not so concerned until you give me the results of all the tests I've asked for is because testosterone feeds back to the pituitary and suppresses the stimulus that makes testosterone. So I predict the free testosterone is going to be okay. I predict the pituitary is not going to have a tumor. I predict that this person isn't a catastrophe waiting to happen, but much needs to be investigated, not the least of which is, especially when a woman exercises a lot, and I mean exercises to the point where their testosterone goes up and they become amenorrheic. They stop having periods, as Patty Doister did. You have to wonder whether there's an underlying mood issue that's being compensated for with that level of intensive exercise. The people who say, men and women, who say to you, I love to push the limit of my exercise. I run until the running does me. I prepare for marathons or Ironman competitions, things like that. Intensive training. Very often is a mood elevator that compensates for an unappreciated, often undiagnosed, underlying mood disorder, depression. So there's lots embedded in the question, and I wish I could give you an answer that says, please take, this nutrient or that supplement, and that's the answer. But it's an interesting question, and if you would let us know what more you find out about this case and how it emerges, because my prediction is it's going to have a physiologic solution, and then everybody's going to breathe a sigh of relief.